Hello! Some lung diseases are actually a complication of our environmental exposure. So I have to ask, what is the environmental exposure of your dad? So, is he a smoker? So, kung nag-i-smoke siya, it's better to stop smoking. Second is that it can be associated with the job. So, most job, they can be exposed to a lot of harmful gases. So, and if he's a farmer, so most of the farmers, especially in field, they're using a lot of insecticide, pesticides, fertilizers. So, they're able to inhale these noxious gases. And it can be detrimental to the health of the lungs. So, one thing to ask is, what is the risk factor of your father in developing lung disease? And what is this type of lung disease? So, if it's cancer, again, my protocol might be able to help. Boston C, 1 teaspoon 3 times a day. Megadose vitamin C, 1 tablespoon once a day. Megadose vitamin C is the best. And pixie dust, 1 teaspoon once a day also. So, if it's a pulmonary tuberculosis, that's also a lung disease. Pulmonary tuberculosis, the best herb is alagaw. So, if you're not familiar with alagaw, please Google it. So, get a handful of it, boil it, drink it 3 times a day, and then you partner it with megadose vitamin C, 1 tablespoon once a day. Also, another herb that is very good for the lungs is oregano. Yan, asparagus, they're all good. And anything, eucalyptus, anything that has that aromatic smell, the volatile oils, because of the volatile oils. So they are very calming to the bronchial tubes or to the epithelium of the respiratory tract. So those can help your father. So you do an x-ray after 1 month of doing this and let me know if it helped. And if it's cancer, make sure that he doesn't eat a lot of sweet stuffs because the sweet foods, cancer, they love sugar. They have 96 receptors for sugar. So imagine if your father is just eating a lot of sugar, so the cancer is also eating. So lumalaki yung cancer. So the normal cells, they have 4 receptors for sugar. That's the most important thing to do. And stay away from noxious gases or poisonous gases kasi hindi maganda sa kanila yon. Thank you, and I hope you enjoyed this video.
Okay, so Miss Rosary Pearl Castillo for asthma. Okay, me, I'm asthmatic. Okay, the last time I had an asthma attack was when I was 16 years old. I'm already 40 years old right now. Wait, ayan. So mag-41 na ako. Lapit na. So, it was so severe. Nako, Diyos ko. It was so severe. It was, you cannot, so I feel for you, for all of the asthmatics. So when I was young, I was taking a lot of synthetic medication. And the problem is, nagkakaroon ako ng nginig. So I have tremors, palpitations because of the side effect of the medication. So I shifted to eucalyptus oil. So lagi ko lang minamassage yan sa chest ko, sa back ko. Pagka nahirapan na akong huminga. And I also drink honey and cinnamon. So, yun po yung pinakamagaganda sa asthma. So, lagi ka lang merong minamassage dito sa chest, tsaka po sa back po ninyo. Have allergy, again, the best thing there is honey and cinnamon. I love honey. Those are one of the few herbal medicines that I can drink. Because I'm very, very particular with the taste. Sometimes I really cannot take them. So honey and cinnamon, if you're having an allergic reaction, if you have bronchial asthma, or if you're just basically having a bacterial viral infection, the best thing that you can take is, of course, the honey and cinnamon.
Gamata, Doc, weak lungs.
June Acuna. Hey, June, Reg.
Yes, hi, June Acuna. So, for weak lungs, the ones that I would advise is you can do asparagus, diba? So I think I did some videos about that where we did some asparagus paste.
Oh, yeah.
And you can eat it like 1 or 4, 6, how many times that you want. And then you can also use my...
You gotta admit though, it's tough to get past the first time.
Yes, but you would love it after that. And then siling labuyo can be used for weak lungs, oregano. Now if you're like me, I used to have asthma, bronchial asthma. What I did was honey and cinnamon. And that's the thing that I give my children as well if they're having fever or they have some form of viral infection. Honey and cinnamon if they are more than 2 years old.
Hello, Del Rosario and Santa Arabia.
Stage 4 lung cancer, Doctora, what is the protocol? Again, food. You change the food, no sweet foods, okay, no sugar. And then Boston C, vitamin C, ginger, garlic, and guayabano leaves. So that's the protocol. Dr. Farrah protocol.
Regarding lung cancer.
Ooh, lung cancer.
So let me just let's introduce a situation. Let's say someone has stage 3 or stage 4 lung cancer. What would you recommend for them? Let's say, for example, let's say you're in the Philippines. Okay, they come to see you at your clinic, stage 3, stage 4 lung cancer. What would be your general recommendations?
Well, you have to drink guayabano leaves, ginger, garlic, asparagus, and then if you have Boston C, you know, and megadose vitamin C, and if you have pain, pixie dust. And that's it. Just be patient.
And dietary modification.
Yeah, you just have to change your food. You have to change. Why did you develop lung cancer in the first place?
If you're smoking, stop.
Or if you're around people who are smoking. Okay, it's better if you go in a air with air that is fresh,
clean air. Because understand, guys, we used to see a lot of folks, you know, who were moms and wives who never smoked, but who developed lung cancer. But then when you start digging into it, they were always cooking. They were
cooking, yes.
They were always cooking with reusing oils, cooking with these oils again and again and again, and breathing.
Or they're using
these
Teflon.
Oils and Teflon.
Yeah.
And you know, reusing the oil 3, 4, 5, 6 times.
Don't use Teflon.
Until it was black.
If there's one thing, if you're cooking, if there's one thing I can tell you, do not use Teflon and aluminum. That's one of the worst things that you can do for your health. Okay, if you use, because there was an experiment done with Teflon, okay, because that's lined with fluoride, okay, so there was an experiment done with that, and what happened was that there was an animal that was exposed to that, and that bird died.
The gases. Well, the thing is,
he just smelled it,
always,
and he used, no, there's one, okay, oil also, that's very important.
The thing is, whenever you see an old Teflon pan as well, you notice all the stuff that's missing off the bottom of it? It's Teflon. Where did that go?
In your food.
In your food.
And then you're eating it.
And then you ate it. And your body had to process that.
Yeah. But we don't live in a perfect
we don't live in a perfect world. We don't live in a perfect world. But the thing is, our health is a result of our choices. And so what we always have to do is make the best choices we can. Control what we can control to ensure we're going to have the best health possible. Okay.
Yes.
The thing is, when folks say, "Well, what is an alternative?" You know, for bread or rice or pasta. You know, the thing is, we'll start introducing some different alternatives, but you have to realize you get sick because of the choices you make, and if you don't want to change the choices, you can't expect to return back to health. Okay. So sometimes it's about making sacrifices. If a person's accustomed to eating rice with every single meal, well, you gotta make a change, especially when they're sick. You know, you can't continue to do that. You know, for example, if I keep smacking my thumb, Mom, with a hammer, and I tell you, "Gosh, my thumb sure does hurt," the first thing you're gonna advise me to do is to stop smashing my thumb with the hammer, right?
You're right.
That's right. You gotta change it.
So for all of